Well, now we are checking in with our teeth. They really offer everything here at Sacred Circle Healthcare. And I'm here with Dr. Larson, and you are the man in charge of all things teeth at this facility.
That's what they tell me.
Uh-oh. I hope you have a little more confidence in that. Okay, so what we want to talk about is what services you offer here and who is your demographic to start with?
So being that we're located in downtown Salt Lake, there's a pretty big population of patients who just don't get what they need for dental care or a lot of other health care. So a big portion of the people that we see are going to be refugees coming in from other countries, immigrants, underprivileged children. There's just a lot of people who we don't normally find in a typical dental office because they don't have insurance or access to care like other people do. So that's who we focus on seeing with outreach programs or going out to elementary schools to try and bring them in.
Oh, great. Okay, so you're talking about elementary schools. How important is it that we're getting our kids in here to have their dental care done?
One of the most important things we can do is start early with kids. And
how early is early?
Well, that's a good question. A lot of people don't know that, but the ADA, the American Dental Association, recommends that we have kids come in by age 1 or when their first tooth comes in. So that should be your first visit, and it's a really simple visit just to help them get used to coming in to see the dentist.
That seems really early. What do you have to say to parents that are thinking, my kids' teeth are going to fall out anyways. Why do we need to come in that soon?
Yeah, I mean, they will. They'll fall out. But so there's an interesting statistic. If we get kids in early, before the onset of cavities, okay, so we're talking age 2, age 3, really quite early, and we apply a fluoride varnish treatment, for example, to their teeth 3 times a year, that will have an effect for the rest of their life at reducing their risk of cavities. Even though these are the baby teeth, it's that kind of care that will help set them up for good teeth in the future.
Okay, so I heard you say 3 times a year. Is that how often you recommend parents are bringing their kids in?
For little ones, I would do that, yes, because that fluoride benefit is huge for them. And so a lot of times we look at what coverage they have. So when we have an underserved population like we have here, they'll be covered by Medicaid. And one of the benefits they can get being covered for children, being covered by Medicaid, is a 3 times a year visit. For adults, maybe 2 times a year is fine.
Okay, that's so great. So let's talk about the adults because you serve the whole family here. What benefits do you have for adults?
So I think the biggest thing that we want to tell people is that, so there's the adage, the squeaky wheel gets the grease. Mm-hmm. We want to change that, right? Don't wait until your tooth hurts to come in and see the dentist, because the preventive care is still just as important for adults. And by treating those things early, we can prevent the toothache in the first place.
Okay, great suggestion there. And of course, we all hear, if you take care of your teeth, it helps your overall health. Is that really true?
Yeah, I mean, if you think about it, your mouth is the gateway to your body. So you put in the nutrition that you want, and anything that's living in your mouth that you don't want is also coming in. So it's important to make sure that we keep that area healthy as well. It has an effect on diabetes or pregnancy, preterm low birth weight. Those things can all be affected by mouth health.
So take care of your teeth. How many times a day do we need to brush our teeth?
Should be brushing at least twice a day and flossing at least once.
You heard it right here. If people are coming for their first visit, for children especially, what can they expect?
So the first time they're going to come in, we'll welcome them and help them be feeling comfortable sitting down in one of our chairs with the staff. And then we'll take a few x-rays to see what we can see. I'll take a few minutes and examine each of the teeth and make sure those look healthy. We'll look at the x-rays, make sure those look healthy, and then we'll clean and polish and put some fluoride on to keep them healthy.
That doesn't sound too scary for a little kid.
It's not too bad. Most kids get through it just fine.
All right, where are you guys located here at Sacred Health?
We're at 660 South and 2nd East.
So come on down and get your teeth checked, both for you and your children. We're not going to check in with Brooke, who's getting her feet checked on.
I am here with podiatrist at Sacred Circle Health Center. This is Dr. Eddie. Thanks so much for joining me, Dr. Eddie.
Thank you for having me.
Now, you are a very in-demand guy, so if I've got foot problems, am I going to have to wait weeks and weeks to come in and see you?
No, in most cases, we can get patients in with Medicaid within at least 1 week.
1 week? I thought if you have Medicaid, you have to wait weeks and weeks.
Oftentimes that's true. Many clinics are not able to get Medicaid patients in near as fast, but here at Sacred Circle, since all we see is Medicaid, we can get them in fairly quickly, and that helps quite a bit on being able to prevent some of the problems from getting worse.
Get those problems handled quickly. Now, you guys also are completely state-of-the-art. You've got tons of technology here. Break it down for me.
Yeah, so our single biggest thing that is amazing is we have a blood lab that we can usually get results back within about 20 minutes depending on the test.
Oh, great. That's so fast. 20 minutes?
Oh, yeah, it's wonderful. So the other things that we have is we have X-ray. Our radiology tech comes in and she takes the X-rays. We have a board-certified radiologist that overreads all the radiographs, and we also have ultrasound.
Oh, and that's super rare, especially for podiatry, right?
Yeah, there's not a lot of offices that have ultrasound. We have ultrasound in all of my private offices, and then Sacred Circle was good enough to get us an ultrasound machine here so that we can look at a lot of the soft tissue that you can't see on X-ray.
So you can actually know what is going on. Now, what is Dr. Otto up to?
So Dr. Otto's our urologist. Dr. Otto he gets to play with the toys right here that are behind us. That's the cystoscope, and so he can actually do a lot of in-office procedures with that.
Now, when your feet hurt, everything hurts. You're just plain unhappy. Because a lot of people think, it's just my feet, I'll be fine. But we should actually come in and see you immediately, right?
Oh, absolutely. If your feet are hurting, there's a lot that can be done. We can do a lot of conservative treatment to try to get you out of pain, and there's usually surgical options, but that's not always the plan. So we don't always have to go that route.
So what are some of the things that you see most patients for when it comes to podiatry?
So the single biggest thing is diabetes. If you're a diabetic, you need to be seen at least once a year. If you have any foot issues, like any sores or anything that you're struggling with as a diabetic, you really need to get in as quick as possible so that we can get that healed. The other things that we see quite often are anything involving pain or any trauma. So if it hurts or if you break it, we can usually fix it.
Okay, perfect. So I'm one of those people that typically, if something's bothering me, I'm like, walk it off, rub some dirt in it, you'll be fine. But that's actually the wrong thing to do, right, Dr. Eddie?
Yeah, it can actually make things worse in some cases.
Yep.
if our diabetic patients ignore it, that's how we can have some pretty bad complications. And you can have complications even if you're not diabetic. So we just like to check everything and make sure that you're going to be okay.
So what if we're unsure if we've got a serious problem? Can we come in and you can figure it out for us?
Absolutely.
And we can come see you right here at Sacred Circle, right?
That's right, every Wednesday.
Okay, every Wednesday. If you've got foot problems, Dr. Eddie is the guy to go see, so we'll be right back.